I'm Josh. My current job title is I'm an associate lecturer in the clinical skills department. And essentially the clinical skills department is responsible for the skills training that the nursing and midwifery students undertake during their time at Middlesex over the 3-year period. I mainly focus on caring for deteriorating patients, CPR. I also do little bits of moving and handling and other skill sessions as well, but mainly focusing on resuscitation-based training as well. But a typical day for me is that I would initially come in probably for 8 o'clock, set up a room ready for the students to come in at 9, for example, and just go through, get up the power presentation, set up the mannequins on the floor that we use for CPR, set up some of the simulation rooms, and then we will be teaching CPR on to a class size of maybe anything between 10 to 30. And it's broken up into over the 3-year period. So obviously our first years, it's not so intense compared with 3rd year training. So we then focus usually on CPR in the morning, and then we do some other bits of teaching like how to recognise deterioration, how to use national early warning score systems. So we'll do some teaching on that. And then in the afternoon, and this is the bit that I enjoy the most, we do our simulations. And it's an area that I'm really quite interested actually for how we use simulation to teach nurses, especially as there's a reduction in practice placements at the moment. So we're just coming up with other ways that we can teach students using high fidelity mannequins. So when the simulation takes place, we'll usually get them to group in about groups of 5 or 6. Go down into our simulation room where we record and the rest of the students get to watch upstairs. And then we give them a scenario and then expect them to act as students, or 3rd years will say to them, we expect you're going to be nurses over the next couple of months. Let's pretend you are a nurse now. What would you do if this situation occurs? And then there's usually a facilitator in the classroom with them that's just making sure that they're going along the right lines and putting them into the right direction. And then after that, we then go upstairs and we give a debrief, have a little bit of a reflection. And the debrief is what I enjoy the most, actually, getting the students to reflect on their practice and then come away with action points as well as to what they can improve on. That's pretty much a typical day for me.